Hi, my name is Brittany Wilson, and I did a topic on autism and specifically referring to verbal communication in the classroom for these types of kids. I would first like to discuss the specific characteristics of children with autism. There's a very wide range and spectrum of autism, of course, it encompasses a lot of different specific needs and aspects. Specifically referring to language, children that are more on the Asperger's syndrome side of autism tend to have obsessive talk about special interest, but they do develop speech traditionally. They can have mostly understandable phonology and usually know and understand all the different word categories and phrase structures like that. Some students with autism have, rather than Asperger's syndrome, have monotonous speech. Sometimes they whisper or like to sing speech. They will do rapid, repetitive phrases. And sometimes they have confusion with pronouns. But most of the time, they're unable to actively participate in conversations as a result of not understanding or just not being able to produce all the necessary vocabulary that they need. Moving on to sensory processing is a very unique aspect of children with autism. They usually are very sensitive to certain visuals and audio, but they also have a keen interest in some tangible textures. Some kids will use headphones if they're oversensitive to certain noise or loud sounds, and they will also like to fixate on certain objects that you could call stimming on something visually or other tactile needs. As far as cognitive, students with autism can have a very wide range in cognitive abilities, but the biggest thing is they're not capable of understanding social cues or mind reading, or they do not develop a shared attention for others, don't engage in pretend play, or use imagination, but they do have strong areas and special talents such as music, math, and very good at memory and art. As far as social and behavior, like I said, they do not understand the concept of mind reading, don't typically look at others in the eye, and they have a lack of interest in engaging with others socially or developing relationships with peers. As a result, the lack of proper communication or social engaging, they develop abnormal behaviors or self-stimming activities such as hand flapping, scripting, or the display of maladaptive behaviors that can be aggressive or emotional. Physically, students with autism have fine motor delays, some gross motor delays, as far as balance and walking and things like that when they're younger. Their daily living skills are always affected by their physical abilities, such as writing, holding a toothbrush, just the basic grooming needs. Overall, autism includes verbal functions in children with autism include abnormalities in conversation abilities, abstract language ability, absence of imaginative activity, and speech loudness and rhythm. Overall, this disorder is very complex and is caused by a brain dysfunction, and impairments, like I said, can be mild or more severe. These impacts of autism on family is very prevalent because they usually require many different services such as speech, physical, and occupational therapy. Many students with autism do behavior therapy services, or it's called ABA, or applied behavior analysis. They usually require many regular doctor appointments for medications and if they need to get a diagnosis. But it's very helpful for families to talk with teachers to correlate the visual schedule and cue cards at home and help create structure and promote proper communication at home. Um, Overall, for the classroom environment, there are a few things that are very important for the teacher to do in the classroom. That includes structure and consistency, using visual schedules and communication cards, using constant reinforcement for appropriate behavior, using behavior intervention plans to decrease maladaptive behaviors, use a reward system for work sessions, one-on-one academic instruction with the teacher, as well as small groups or activities for social interaction. Um, and, and they also need frequent sensory breaks to avoid overstimulation. And you can also use technology for academics or communication devices. And it is just very important for these students to have strict structure and constant reinforcement to keep them engaged and active. So overall, I hope you learned a little bit about autism and their classroom environment and their verbal communication. Thank you.